If you have a bladder infection caused by certain bacteria that leads to high levels of ammonia in your urine, your doctor may prescribe acetohydroxamic acid tablets to be taken with antibiotics and/or surgery. By stopping the bacteria from producing ammonia, this medication can help slow the growth of kidney stones and improve the effectiveness of the antibiotic in treating your infection. It's important to follow your doctor's instructions on the daily dosage and the best time to take this medication for the best results. Before you start using acetohydroxamic acid, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth on an empty stomach as directed by your doctor, usually 3 to 4 times daily. The dosage is based on your medical condition, weight, and response to treatment. Use this medication regularly at the same times each day to get the most benefit from it. If your condition lasts or gets worse, make sure to inform your doctor. If you experience headaches, nausea, vomiting, stomach upset, unusual hair loss, or loss of appetite, it's important to tell your doctor or pharmacist. This medication has been prescribed because the benefit to you is greater than the risk of side effects for most people. However, it's important to tell your doctor right away if you experience any serious side effects such as fast or pounding heartbeat, unusual tiredness, weakness, dark urine, mental or mood changes, shaking, pain, redness or swelling of arms or legs, easy bruising or bleeding, signs of infection, or chest pain. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction such as rash, itching or swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist. Remember to always consult your doctor or pharmacist before starting or stopping any medication. Before taking acetohydroxamic acid, it's important to let your doctor know if you have any allergies, as this product may contain ingredients that can cause allergic reactions. Also, inform your doctor about your medical history, especially if you have kidney disease, blood clots, blood/bone marrow disorders, or if you regularly consume alcohol. While taking this medication, it's best to avoid alcoholic beverages, as they may cause a skin reaction. It's important to use reliable forms of birth control while taking this medication, as it should not be used during pregnancy, and may harm an unborn baby. Additionally, this drug may pass into breast milk and have undesirable effects on a nursing infant, so consult your doctor before breastfeeding. When taking acetohydroxamic acid tablet, it's important to be aware of any potential drug interactions that could affect its effectiveness or lead to serious side effects. Make sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. It's essential to consult your doctor before starting, stopping, or changing the dosage of any medicines. One specific product to be cautious of when taking acetohydroxamic acid tablet is iron-containing products taken by mouth, such as supplements or multivitamins. These products may interact with the medication and affect its performance. Be sure to discuss with your healthcare provider the best time to take your acetohydroxamic acid tablet and the appropriate daily dosage for your specific needs. If you or someone else has taken too much acetohydroxamic acid and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., you can reach out to your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include loss of appetite, weakness, unusual tiredness, nausea, vomiting, and shaking, tremor. It's crucial to seek medical attention if any of these symptoms occur after taking acetohydroxamic acid tablets. It's important not to share this medication with others. Your doctor may also require you to undergo lab or medical tests, such as a complete blood count or liver/kidney function tests, while you are taking this medication. Make sure to keep all your medical and lab appointments, and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it is close to the time for your next dose, just skip the missed dose and take your next dose at the usual time. Do not take a double dose to make up for the missed one. When it comes to storing acetohydroxamic acid tablets, make sure to keep them at room temperature, away from light and moisture. Avoid storing them in the bathroom and always keep them out of reach of children and pets. When it's time to get rid of this medication, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it's expired or no longer needed. If you're unsure how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.